And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we are going to be talking about helmets, what they do, but also what they don't do. And this is not just people who would be wearing helmets for something like motorcycles. We're also going to be talking about mountain biking, road biking, but also if you're on a scooter, if you are a skier, snowboarder, different things like that, and how it's going to protect your life. But in the same breath, there are certain things that you may not always think about right off the bat that helmets do not actually protect. So let's jump into that, have a little look here. First up, we've got a study that was done back in 2018. This was done in a hospital setting where they went back and looked at over 1,000 records of people who were involved in motorcycle accidents, some who were wearing helmets, some who were not wearing helmets. And they wanted to see if there was any difference in terms of protecting against injury, because there is a certain idea out there that helmets don't actually protect against injuries in motorcycle accidents. So they said, we're not so sure about that. Let's go and have a little look. So what were some of their results? On the average, helmeted riders had a much lower injury severity score. Cervical spine injury occurred in 114 unhelmeted riders, compared with only 24 helmeted riders. In other words, it reduced the risk of injury by 50%. That is an absolutely huge amount. Now, I'll show you a picture in just a sec here to highlight on that, but interestingly, they say that there was no difference found in cervical strain, cord contusion, or nerve root injury. So my point here is that I want to illustrate that there can be different levels of injury that are involved, and helmets do protect against certain kinds of injuries, but not necessarily others. A picture says 1,000 words. So here we have straight from this particular article, fractures. You can see that if you were not wearing a helmet versus you were wearing a helmet, the injury goes way, way down. Same with damage to the spinal cord itself, a cord contusion, or major ligamentous injury. In other words, a full tear. And we're going to talk about that just a little bit later. But what I also want to illustrate in this particular study is something that the authors discussed, but they didn't really dive into, and that's going to be the purpose of this video here, is that if you were looking at nerve root injuries, so that is the nerves as they are going to be exiting the cervical spine, and also cervical strain, damage to the muscles, damage to the soft tissues, the connective tissue that stabilizes the spine itself, helmets actually didn't protect. So oftentimes what will happen to a person, and first and foremost, let me say, if you're going to be doing any kind of a sport or an activity where there is high speed and the possibility of having head damage, neck damage, please wear a helmet. It is going to protect you, especially if you've ever had an injury and you've got a cracked helmet. The helmet very likely is going to save your life against fracture and major ligamentous damage. In other words, the things that could potentially kill or cripple you. But in the same breath, the helmet in and of itself does not protect everything that goes on in the neck. And oftentimes when a person's in a trauma center, what are they looking for? They are looking for broken bones, instabilities, dislocations, bleeding on the brain, or major lacerations. They're not looking necessarily at the soft tissue injuries, and they're oftentimes going to say, okay, yep, that's not going to be an issue. Just do some gentle mobilization, let it heal, and it's going to heal. It's going to heal, but the question is it going to heal the right way? And this being the case, it means that the treatment that they may be able to provide in a hospital setting, and they say, nope, you're clear, everything's fine, that doesn't mean that everything is necessarily 100% okay and that you don't need any treatment at all. So we've got two ends of a spectrum in terms of what's going on. Remember, in a hospital setting, they are looking for fractures and dislocations. This is the orthopedist. Okay, this slide was from when I was still in Australia. Okay, so it's spelled with the Australian spelling. So we take away the A for our American audience here. This is where you need the orthopedist, you need the surgeon who's going to be involved. Why? Because these are the dangerous things that are going to kill you or cripple you. On the other hand, the lower end, these are going to be minor little tweaks, a bruise, a boo-boo, something like that. And this is where soft tissue rehabilitation, this is where strain, counter-strain, massage therapy, physical therapy, this is what is going to work the absolute best for helping these kinds of injuries. But my point here is that there are also other injuries. They're not on the major traumatic scale, but they're also not on the minor. They're in this big gray zone. And unfortunately, those are often neglected. Because again, the emergency room department, they're looking for the things that are going to kill you or cripple you. You could have other kinds of injuries happen to your head, happen to your neck, that are somewhere in between that. And they may not necessarily cause instant problems, but these can be issues that can build up over a period of time unless you get them properly assessed, properly treated. Because as we said, your body's going to heal, but the question is it going to heal the right way? And this is one of the reasons why I would advocate, if you are doing a sport where, again, a helmet is advised, motorcycle riding, road bike riding, mountain bike riding, horse riding, skiing, snowboarding, any of these kinds of things. If you ever have that fall, that injury, even if you think that it's relatively low speed, very important that you have your neck assessed, not just for the major trauma, but also the smaller trauma that can cause damage on the inside to the muscles, the ligaments, the joints that allow your body to work. I mean, let's think about this for a sec. It's impossible to hit your head and crack a helmet without also damaging your neck. And the symptoms of whiplash and concussion are near indistinguishable. So just because you may not have the head trauma does not mean that the neck is affected in some way that can and does cause strain to muscles, ligaments, nerves. And as we saw in that research article, that even if you are wearing a helmet, it doesn't necessarily protect against these particular kinds of injuries. Now, I should also make a point of clarification from one of my previous slides, the one we were talking about the levels of trauma. Fracture, dislocation, and then subluxation. When it comes to ligament injuries, there are different levels that are involved, and depending what profession you are chatting with, you may get a slightly different answer. So let me clarify this. From a medical perspective first, a subluxation is what's known as a grade 3 or a grade 2 ligament or a joint injury. That is where if you are looking at the opposing surfaces of any joint, I don't care if it's in your neck, your low back, or your little toe, the joint should be normally aligned and normally moving within a relatively stable orbit of flexibility. A grade 3 injury is where the whole ligament is torn. It is essentially dislocated. From a medical perspective, they do not diagnose a subluxation until you have damage upward of about 50 to 66%. This is what's known as an unstable joint sprain, aka subluxation. But my point here is that you can still have damage on a much smaller scale. Let's say it doesn't quite reach that 50% or that 66% threshold. That does not necessarily mean that no injury has actually occurred. So if you were to instead talk with either an chiropractor, or if you were speaking with an osteopath or a physical therapist, we're going to be talking about grade 1 or grade 2 injuries. This is where you don't have a full-blown rupture of the ligaments, but you do have damage that can not always show up on a major MRI scan. Part of the reason for that is unless you are getting an extremely high resolution MRI, and these are unfortunately relatively rare around the world because they take a lot of time, a lot of energy, and there's a huge cost associated with doing them. You are not necessarily getting the high resolution images where you can see these micro damages where we're talking about less than millimeters worth of tearing. But let's also not dismiss the significance of that, because the nerve receptors in your neck, and you've got three different kinds. You've got ones that are involved with pain, you've got ones that are involved with regulating muscle tension, and you also have others that are involved with mechanical sensations. These ones are going to correspond and go to the parts of the brain that are responsible for balance, equilibrium, things like that, that they will detect this kind of damage, even if it's happened on a very low scale. So if you have had that particular kind of injury, just because you rule out the big dangerous kind of things does not mean that you are not sitting in some kind of a gray zone. And if you just say, oh, okay, yep, no fracture dislocation, I must be fine. I mean, they said that I was okay. It's worth getting a different perspective, because we are looking at different kinds of entities that are going to be involved here. And even if you have only, again, that micro damage, if you allow that to accumulate over a period of time, that can start to contribute to a wide variety of neuromuscular symptoms. It's going to be neck pain, shoulder pain, headaches, TMJ pain, dizziness, vertigo, post-concussion syndrome, all of these different kinds of things that we don't necessarily think out being associated with the neck, especially if somebody told us that we don't have any particular injury. But again, we're talking about different levels of injury. So the question is how do you get that assessed? Well, some of the best technology out there, first and foremost, is what's known as a DMX scan. So this is a scan, essentially a moving X-ray, where you take your neck through ranges of motion to see if there are joints that are moving more than they are supposed to be. And if this is the case, this is where different kinds of therapies, such as prolotherapy, such as injections, they can help to stabilize those ligaments. But what I do want to emphasize is that in and of itself, that may not necessarily solve all of the problems, because we know that the spine moves as a unit. So if you have excessive mobility in one area, it's also possible that you have decreased movement in others. And then this is where something either known as a DAX or a CBCT scan can be super duper useful. And this is something that's going to be done by what's known as an upper cervical specialist. This is a type of chiropractor that does not do any twisting. There's no stretching, there's no drugs, there's no surgery. But what we're doing is we're doing a more detailed look at the structures of the neck using a scan, something like this. You can take a complete 3D reconstruction of what's going on to look at any and all of the joints to see, are they actually sitting where they're supposed to? Are they moving the way that they are supposed to? And done in an upright position. See, in the hospital, because they're looking for fracture dislocation, a good chunk of these are going to be done where you are not seeing any signs, you're done lying down. And so you're not necessarily seeing these particular kinds of disrelationships. When you're doing it in an upright position, kind of as I'm illustrating right here, you can see if the joint margins are actually sitting the way that they are supposed to or not, versus, so we've zoomed in there a little bit, so you can see that joint may not be all the way over here, but it is certainly not sitting exactly where it is supposed to be. Versus if we're going to have a quick look over at the other side over here, we see this, this is what normal is supposed to look like, sitting nice and neutral like that. And again, unless you take the time to actually look at these things in a more detailed perspective, you don't necessarily see what's going on, let alone the type of treatment that's necessary to help resolve these kinds of conditions. But one of the cool things with the technology as well now these days is that you can get a complete three-dimensional reconstruction of all of the features, all of the structures in the neck that allow us to better understand these different levels of injury. Again, on this particular scan, we're not looking for fracture dislocation, but we're looking to see what's the biomechanical arrangement of all of these vertebrae. Have they been injured on a lesser scale, but nevertheless no less clinically significant? So again, it is very much a matter of perspective. And just because there's no bleeding or broken bones does not mean that everything is necessarily fine. So in summary, should you wear a helmet? The short answer is absolutely yes. Is that going to protect you against all injuries? No, it won't, particularly injuries of the neck. And when it comes to neck injuries, one of the best places to start then, as we had shown you there, to look for these micro pieces of damage that are going to be affecting your health, your well-being, is starting out with a craniocervical specialist. Again, this is a different type of chiropractic, no drugs, no surgery, no cracking, and no twisting either. And if you can help stabilize things to make sure that the body's going to be healing the right way, this does not have to set you up for issues later in life. So thanks for watching this video. If you did enjoy it, please do click that like and subscribe button. If you've got friends, family, clients, colleagues who you think could benefit from watching this, please share this video with them. And even if you did have some kind of an injury going back into the past, if you have never had your neck properly assessed, it's worth doing that, because yes, ideally we would have been able to catch that injury within the first couple of weeks after it had happened, but body never forgets how to heal itself. Even if that injury was 10, 20 years ago, there are still things that can be done to help stabilize things so that you're not going to be having the kinds of issues that you may be experiencing forward going. If you want more information about this, you can go over to my clinic website. You go to chirospokane.com, where we've got all kinds of other videos, blog articles about different conditions that we can see can have a connection with what's going on in the upper part of the neck. And if you're then looking for a practitioner in your area, there's a directory called UCC Near Me. You can go to that website, find a specialist near you, and hopefully start enjoying the benefits, getting your better quality of life. So again, thanks for watching this video. This is Dr. Jeffrey Hanna at Chiropractic Spokane.